When is an X-ray or an MRI needed for low back pain? In this video, we'll talk about some of the indications for when to get imaging for low back pain, and then we'll also discuss some evidence-based treatment strategies for low back pain. Imaging for low back pain is used to make sure that the pain is mechanical in nature and it's not caused by a serious pathology. Generally, serious pathologies for low back pain include cancer, fractures, cauda equina syndrome, infections, and aneurysms. Even though these account for less than 1% of low back pain episodes, it's really important that we recognize these presentations so that they can be treated appropriately. And the way that we do this is with screening questions for red flags, which lets us know if imaging is necessary. For cancer, a history of recent cancer, unexplained weight loss, and increasing pain at night are some of the screening questions. For a fracture, we're looking for a history of significant trauma, use of steroids, and osteoporosis. Infection, we're obviously looking for a fever, use of steroids or immune suppressant therapy, and IV drug use. Then cauda equina syndrome is when there's compression on the lower spinal cord, so we're looking for saddle numbness and tingling, or bowel and bladder issues. While answering yes to any of these questions doesn't necessarily mean that the low back pain is caused by a serious pathology, it does raise our suspicion. Just like if we answer no to all these questions, it doesn't mean that we can be absolutely certain that a serious pathology doesn't exist. Now you might be thinking, why wouldn't we just take images on all low back pain episodes to screen for these serious pathologies? After all, we definitely don't want to miss one of these diagnoses. The problem is that this strategy of imaging everybody without an indication of a serious pathology doesn't improve clinical care. Additionally, there are some issues with unnecessary imaging. For example, unnecessary imaging has been linked with an increased risk of transitioning from acute to chronic pain. Additionally, a lot of the structural things that we might see on an X-ray or an MRI have a poor association with pain. So if we take an unnecessary image, we might actually get worried about some of the findings that we see. We might develop some fear avoidance behaviors, and that might limit our recovery. So for these reasons, that's why routine imaging isn't used for low back pain. This brings us to the treatment for low back pain, which is the entire reason why you'd be seeking imaging, at least that's what I would assume. And obviously this could be an entire video on its own, but let's at least take a look at what an evidence-based treatment approach would look like. Generally, treatment is divided into acute and chronic low back pain, with chronic low back pain being anything that lasts over 3 months. For acute low back pain, superficial heat, spinal manipulation, massage, and acupuncture are all recommended as non-drug treatment options, while NSAIDs are what are recommended for a pharmacological option. And then for chronic low back pain, exercise therapy and cognitive behavioral therapy are the two primary treatment options, while spinal manipulation, massage, acupuncture, yoga, and mindfulness practice are what are recommended as adjunctive treatments. And regardless if it's acute or chronic low back pain, the recommendation is to try to remain active within tolerance. And obviously there's a bunch of different treatment options for acute and chronic pain, and we don't have to pursue all of them. But it's finding which ones somebody responds best to, and then gradually build from there until we're able to return to our normal activities without pain. So hopefully this video provides some insight on indications on when imaging is necessary for low back pain, and then some general guidance for some treatment options that are supported by the research. If you've made it this far in the video, go ahead and hit the subscribe button over here. If you have questions, leave them in the comments below. I'll see you in the next video.